Hi, I'm Kate Krieger-Watkins here with a special edition of The Scoop for Mason County Press, brought to you by Spectrum Health Ludington Hospital. And today I'm joined with 4 members of the hospital. And if you guys could go along and kind of introduce yourselves to everybody watching and kind of your role of who you are and what you do here at the hospital. Helen, I'm going to start with you.
Certainly. My name is Helen Jonson. I'm the Chief Operating Officer here at Spectrum Health Ludington Hospital. I'm also serving as the interim president currently, and I've worked at this hospital for almost 15 years, originally from Oceana County. So a little shout out to Oceana County. I know that's part of our service area, and just very excited to be here and start this series and really get information out to the community about what's going on at the hospital.
Great, thanks. Okay, Meleah, you're up next.
Thank you. Good morning, everyone. My name is Meleah Mariani, and I'm the Chief Nursing Officer here at Spectrum Health Ludington Hospital. I am a new member of the team here. I came from the Gerber Hospital, where I was the chief nurse for the past 6 years. Been here at Ludington since December. And also, like Helen, looking forward to just sharing some information with the public about what's going on here and how well prepared we are.
Sure. John, you're up.
All right. Good morning or afternoon. My name is John Sella. I'm the Northwest Regional Controller, serving Ludington and Gerber. Been in rural healthcare for most of my life, with Spectrum for about 15 years and covering Ludington for about 2 years now. So.
All right. Last but certainly not least, Kaley.
Hi everyone, I'm Kaley Petersen, and I'm the Director of the Foundation of Community Services here at Spectrum Health Ludington Hospital. Born and raised in Ludington and always happy to be back and serve hometown. I've been with Spectrum Health since 2010, and I'm excited to be a part of this series and to keep our community informed on key happenings.
Okay, so we are all gathered here today basically because the coronavirus. It is something that people have been talking about a lot. Sorry. And Helen, why don't you give us kind of an overview of what the hospital is doing?
Sure, I'd be happy to do that. So we have a very deep bench of experts across the Spectrum Health system that are helping us not only respond to this, but have been prepared, and we have certainly been testing and doing all of the emergency preparedness drills previously for any of the other events that we've had across our community, whether it was H1N1, SARS, any of those that we might have, those mass incidents where we would have a lot of resources that would be needed, healthcare resources across the community. We partner not only with our Spectrum Health resources, which is infection prevention specialist, emergency preparedness specialist. We're also partnering here locally. We have great resources here in Mason County. So we have our emergency preparedness coordinator for the county. I'm in constant communication with her, constant communication with our District 10 Health Department. We're also talking to Life EMS. Those are great partners of ours to making sure we're getting people into the hospital safely, responding to the community and emergencies. Kim Cole, our local sheriff, is certainly aware of what we're doing. We're trying to keep local businesses aware of what the plan is here at the hospital. We have a great resource out on the spectrumhealth.org website that helps not only community members, but community businesses in their emergency preparedness. So I would definitely direct people to that website.
Okay.
It is a great source of truth. Please make sure you're looking at that, or the CDC. Those are going to be the tried and true
The real facts.
The real facts,
Yeah.
the real truth. That's what you really want to be looking at.
Great, thanks. Now, Meleah, you're Director of Nursing. So from like a clinical standpoint and actually dealing with patients, what is the hospital doing?
Absolutely, thank you. Several things that you'll see if you're visiting the hospital that are outside of our normal routine. The first thing is that we are restricting visitors. Probably the audience has heard that the governor has some mandates around that. Obviously, we want to comply with that. So it's not business as usual. If you do come to the hospital, you will be asked to enter our doors through either the emergency department or our surgery entrance.
Okay.
And there you will encounter one of our wonderful staff who will ask you some questions and screen to make sure that you are safe to come into the facility, or if you are having any type of symptoms, they will provide you with information on where you could go to be further evaluated. The intent there is to make sure that we are paying attention to safety. safety of the community, safety for our patients, and safety for our staff, because we need them to be healthy to be able to take care of you. So that's one thing. We are also rescheduling things that are not emergent, and I know that that might be inconvenient and it might be a little bit difficult. However, again, along the lines of safety and to make sure that we do have everybody at the ready should we need to be. Things like non-emergent procedures, elective procedures, if you don't need to visit your doctor's office if you're not ill, some of the well visits would be rescheduled, things like that. So we do appreciate your patience and understanding with that. Our community has been wonderful in terms of complying with everything. People seem to be very pleased that we're paying attention to the safety measures.
Okay, John, you're a finance guy. So what do financial things have to do with what's going on with the coronavirus? Yeah.
You know, a lot of our focus really has been not so much on, we don't really know the duration of this event and how long that's going to happen. So with respect to how that affects the hospital and the community, we know we're, as Meleah said, we're canceling not unnecessary, not urgent cases, moving those out where we can. We don't really know when we could reschedule some of those things to resume normal operations. A lot of our focus has really been on how do we protect our staff? Mm-hmm. So do we have the supplies we need to protect staff and our patients? And really just kind of ramping up that preparedness activity to make sure we can keep people safe and that we have the resources here as this ramps up and we get into it farther. We don't know how long, we don't know how long the event will occur. So just trying to plan ahead and plan for whatever happens as far as what we can predict at this point.
All right, great, thanks. And Kaley, you do a lot of the community aspect. There's a lot of different groups that meet and like Fit Club and some other things. So what is your role now of kind of, again, rescheduling and kind of putting things on hold, I guess?
Yeah, and that's exactly what we're doing. So really through the month of May, we've canceled truly all of our community benefit classes, right? Because obviously with the mandates and the limitations that we can have on how many people gather, it's just the right thing to do. So all of those classes have been canceled through May. They can find that list on the Spectrum Health website, specifically the spectrumhealth.org/COVID-19 website. Okay. We are doing our best to update that as this fluidly changes kind of day to day. Right. But we also realize that we need to find new ways to try to deliver some of this work. And so we are exploring what are some virtual options. Okay. And so I think more information is forthcoming on that, but we are looking, how can we help our community at large continue to receive this service, but really kind of in a new medium. Sure. So more information to come on that. And then I also do want to say that the other hat I wear is really with foundation work. This has really been a major task for the entire healthcare system across the nation. So we are looking at setting up a COVID-19 foundation fund for any community donor that is interested in supporting. Oh, great. Yeah, so that philanthropy will help support not only our staff in their time of need. We have child care concerns, there's hotel accommodations, those kinds of things, but also truly hospital operations and supplies. So more information will be forthcoming on that, but I think that's going to be something that the community could definitely help support in this time of need. Awesome, great, thanks so much. Anything else?
I would just like to thank the community for their interest in this and say we will get through this. We will get through this together. This community is smart, they are strong, they support each other. Please check on your neighbors, maybe not at their home, but give them a call. Do everything that you can at this point to make sure that our community really shines in the way that we always do in taking care of each other.
Great, I really appreciate it. Thanks for meeting with me today, you guys. And for all the updates, you can either check out the Spectrum website, and we will have other things posted on MasonCountyPress.com. And again, this is going to be a series of different health issue informational meetings on Mason County Press, but we're really trying to focus on the coronavirus right now and what you can do to stay safe and what these guys are going to do to keep you healthy.